Hello everybody and welcome to my vlog. Today's a very important topic. I was getting a lot of phone calls from both sales representatives as well as patients about a voluntary recall by Allergan of their textured implants. A lot of patients are aware of the difference between smooth surfaced and textured implants. Both of them have a role in my practice, and I tend to use a lot of textured implants because they have a lot of benefits over smooth implants. Their surface is kind of like sandpaper versus a shiny beach ball. And what that means is in patients with recurrent capsular contracture or patients who decide to undergo augmentation with a shaped implant or patients who have reconstructive breast surgery, sometimes it's better to use a textured surface to prevent recurrence of capsular contracture, to make sure that an anatomic or teardrop implant doesn't change its position because that'll look funny, and any other number of reasons. I would say 1 out of 4 implants that I place is textured for that reason. As of the past year or so, Allergan's been sort of under heat, if you will, about their BIOCell implants. BIOCell is their manufacturing technique for their textured surface implants. All textured surface implants have been relatively implicated in causing a rare condition called breast implant associated ALCL. Although FDA recognizes BIA-ALCL or breast implant associated ALCL, which is a form of lymphoma, to any kind of implant, to any kind of surface, to any kind of fill, really what we found is textured implants tend to be associated with it most often. And of those textured implants, a macro textured or a coarse grit sandpaper-like surface has been sort of like the number one. So the FDA never formally overruled the sale or production of these implants. In my own practice, I use micro-textured when I decide to use textured, and other manufacturers do make the micro-textured surface. But if you have an Allergan implant that is like a 410 or a tissue expander with a textured surface, or any kind of Allergan implant with a textured surface, chances are the BIOCell process was used to create that surface. If you have that kind of implant in you, and there's a good chance if you're one of my patients that you do, it was definitely in control of the market for years, there's no need to panic. BIA-ALCL is still an incredibly rare and treatable condition. It's impossible to tell exactly how many cases there are, but as of July 2019, there are about 250 cases ever reported in the US and 750 or less worldwide. And what that means is 1 out of basically 4,000 to 30,000 implants may end up with this. I may never see this in my practice. And frankly, I know one surgeon who's seen a patient with it. So it's very rare. And if you do have it, it's not life-threatening. It is life-threatening technically, but it's also incredibly treatable. You just need to be in close contact with the plastic surgeon. If you notice any kind of like swelling or changes, have it looked at. It doesn't mean it's BIA-ALCL, but a well-trained and well-versed plastic surgeon will be able to sort of look at it and reassure you what's going on. If you have these implants, like I said, keep close eye on things, but chances are you'll be okay. And you don't need to have them taken out. If you want them taken out, that's your prerogative and we should discuss it. It's totally fine. I understand your concern, but sometimes the risk of another operation is greater than the risk of a curable condition. So you've got to sort of weigh everything in here. I still use textured implants. I will not be using or offering the Allergan textured implants for either reconstruction or cosmetic purposes, but I actually haven't been using them anyway for the past year or so, ever since I kind of got wind that they were implicated based on the most current research. So in summary, no need to fear. I'm here for you. If I've placed your implants or if anybody else has, certainly come in and see me. I'm happy to switch them out or take them out altogether, but you don't need to. The FDA doesn't recommend taking out these implants if you don't have any symptoms. I think close follow-up is more important. And I hope you are all doing well, and I'm happy to present this implant-based patient safety announcement. Be well.